And welcome back. Well, back pain can be super frustrating. It not only keeps you from doing things that you love, but it can prevent you from earning a living.
Yeah, nearly 5 million Americans, in fact, are on disability for lower back pain. It is the leading cause of disability in adults under 45 years old. And here now with a minimally invasive solution is Dr. Shekhar Dagam with some ideas on how people can treat this problem and get back to their life. Great to see you.
Yeah, thanks for being
Nice to
here.
see you guys again.
Let's talk about this kind of pain, first of all, because the pain we're talking about specifically tends to be in the lower back.
That's correct.
Right? Radiates to the legs sometimes?
Yes, absolutely.
Okay, and could be in the hip maybe also?
Yeah, it can be in the low back, hip, leg, and that whole area we always look at the back or maybe just areas right underneath the back.
And is it generally caused by arthritis or or is it an injury? What causes the pain for most of your patients?
Arthritis is the most common cause, but certainly an injury can be the cause of it. They could have hurt themselves at work or in sports. Or just doing work around the house.
And anybody who's had lower back pain knows how debilitating it can be. You can pinch a nerve, you can not be able to work, you can't do your regular functions, you can't do activities. So people probably come to you and they're interested in figuring out what's wrong with their lower back. One of the things that you do is a lumbar fusion. What is it?
A lumbar fusion is when their low back pain is caused by abnormal movement and tremendous amounts of arthritis. So we're able to go in, clean out the arthritis, and fuse the areas together to prevent pain, so they can just be much more productive.
What are we looking at in this image here? I know at the top it says minimally invasive. What's happening?
Yeah, so what normal back fusions are is we go in and we move the muscles to the left and right, and you can see that in the lower left picture, and that's in B. And what the idea is with minimally invasive is we're going through the muscle and we do it through a series of tubes, and that's going to be in C. And the idea there is if you have less muscle cutting, less muscle disruption, patients will feel tremendously better after surgery and be
quicker recovery.
Tremendously quicker, tremendously quicker.
So okay, so this is going to be called then the minimally invasive lumbar fusion.
Correct.
For people who've done. I think what's important too is you do second opinions for people. They can come in and have an evaluation of their back. But I bet a lot of people come to you and say, I just can't live my life normally.
Absolutely, and I think that the thing to remember is, we are not there to tell that everyone needs a back fusion. We're there to look at the whole picture and make sure that they've done all the things that you're supposed to do before surgery. And then if and when they are ready for surgery, we want to offer them the best option possible.
Is it successful? How successful is this?
It's actually more successful than regular open back fusion because the recovery is faster, because they're able to get back to, because they have less pain, the overall success is even higher.
And you're not cutting through muscle like a lot of surgeries do. You're going through it basically.
Correct, yeah, because the muscle is a series of fibers that are parallel to each other, and we can actually just move them to the side with lesser disruption. So
people, let's say, are listening to this and they've had chronic back pain or leg pain. How do you know if you might be a good candidate for this and maybe should consider having a second opinion with you?
I think that anyone who isn't having success with non-surgical treatments should look at surgical options. And what's great about this is most people are so afraid of back surgery. This is going to get them back to work, back to normal life faster. This should be a less scary option.
Is it considered experimental? Does insurance cover it?
Absolutely not. If you look at all the other surgeries out there, there's laparoscopic surgery, there's robotic surgery. Minimally invasive surgery has been around for decades. And in the spine, it's being brought to the forefront now, and insurance covers it absolutely.
And to be clear, it's not considered experimental. This is something that's been tried, tested, and has shown great success in many patients.
Absolutely. This is available at all large spine centers.
I think it will come to a huge relief to people who've been doing, as we were talking about during the break, people who've been doing ablations or they've been living with all this pain for so long, they finally can potentially find a solution, get back to work, get back to life.
Absolutely.
You were you're Mayo trained. Your specialty really is in spine management, and it's really getting everything to work so that people can. And we were talking about getting back to life and work, but having solutions for chronic pain that really helps them return to normal activities.
Absolutely, and we have so many different options for them, and we are looking at minimally invasive techniques. We offer several minimally invasive techniques, not just fusions, to help them get back to a full life.
Right. Sounds great. You can have a second opinion or meet with Dr. Shekhar Dagam by having a consultation on minimally invasive lumbar fusion. He's located right on Kinnickinnick River Parkway in Milwaukee. Call for an appointment at 414-385-7150 or dagamneurosurgery.com for more information as well. Thanks for being here.
Thank you.
Great to see you.